Greetings. You see, normally the placenta is situated. You know the placenta. Before I start, let me tell you what the placenta does. You know the placenta is what feeds the baby during pregnancy, right? It feeds the baby and provides the baby with oxygen during pregnancy. So it's very important for the development and well-being of the baby. That is that. Normally, the placenta is situated at the back part of the uterus. That is normal. In some women, during pregnancy, this placenta is located in the front part of the womb. That is also okay. Now, there are some people some pregnant women their placenta will be low lying. The placenta will be so close to the cervix, the one we call the mouth of the womb. Now, that is a problem. Hmm? And that's the reason that why when you are pregnant, the best way you must do a scan. You must do a scan, an ultrasound scan. Ultrasound scan does not just tell you whether the baby is doing fine or not, or whether there is birth defect or not. It also tells you the position of the placenta. There are about 10 things that the ultrasound scan will tell you. So that's why ultrasound scan is a must during pregnancy. You must do it because it will also tell you the position of the pregnancy. And the position of the placenta. And that position of the placenta will determine a lot of things as far as your delivery is concerned. Do you understand? Now, for placenta previa, it occurs when the placenta is low lying. It's lying close to the womb, and there are different types. There are different types. The first type, there is type 1, there's type 2, there's type 3, and type 4. Four different types. Type 1 is close to the placenta, is close to the cervix, but it's a little farther from the cervix compared to type 2. Type 1 and type 2 are okay. They are not that bad. It's not that placenta previa is okay on its own. It's a problem. It's a problem to both the patient and the doctor. The type 3 and type 4 is the major problem. It's where the problem is because the placenta is so close to the cervix that sometimes it will protrude through the cervix and enter into the vagina. So that's where the problem is. Now, the issue with placenta previa is this. Because because it's very close to the cervix and the rest, it is prone to bleeding. Most women with placenta previa will always complain of bleeding, especially the type 3 and type 4. Do you understand what I'm trying to say? The type 1 and type 2, sometimes, because as the pregnancy progresses and the womb increases in size, sometimes the type 1 and type 2 can climb up. Meaning it will go further up away from the cervix. That's why they will say, don't worry, it will climb. Some doctors will tell you, don't worry, it will climb back. Don't worry, this placenta previa, don't worry, it will climb back. You understand that? Now, that is for type 1 and type 2. The type 3 and type 4, most time they don't climb back and they can cause you a lot of problems. So when you have placenta previa, that's not the best time to have sex. You should not have sex when you have placenta previa, especially type 3 and type 4. But generally, doctors will tell you not to have sex at all because you don't know the type. You understand? You don't know the type. You should not have sex. Because during the course of intercourse, your husband, you know what I mean? Your husband's stuff can touch the placenta and you will start bleeding. There are a lot of women that they rush to hospital like that. They say, well, just they do the thing, no. All of a sudden, it just start to bleed. And the bleeding now, it just a pour, just a come out. Your husband can touch you, and because of that, you will start bleeding. And the sex too can cause uterine contraction, and you will lose that pregnancy. You can have a miscarriage. And sometimes you can have premature baby because you deliver before time. I hope this is clear. You will also notice that when you are pregnant with placenta previa, normally they do vaginal examination for patients with placenta previa. Doctors do it, but you notice that when you are about to deliver, doctors will tell you, don't put hand inside we make sure that they don't do that vaginal examination because their finger can touch the placenta that is protruding out through the cervix and it can start bleeding. You understand? Another thing is this. When you have placenta previa, that is not the time to start washing inside your body. You start douching. You pour water inside your body. You know what I mean inside your body, inside your vagina. You pour water inside it and you start washing it because your hand can touch the placenta that is out there and you will start bleeding. Do you understand? So that is it. Now, the best way to your surest bet, your safest delivery method when you have placenta previa is cesarean section. Huh? The cesarean section. And even before that, your doctors will tell you to prepare at least 3 to 4 pints of blood before they can take you for, because the problem with placenta previa is that it bleeds a lot. I just want to clarify the air on this. So I've said a lot of things. Huh? Please, if you have any question, put it in the comment section. We can talk further. One more thing, please. I am on YouTube and I have close to, by now it should be 419 or 420 subscribers. I want to try and get to 1,000 subscribers so that I can monetize the channel. Please, I know you can help me with that. So my YouTube link is in my bio. Is in my bio. And just go to my YouTube and help subscribe. I know you have been supporting me so far. I'm almost at 5,000 followers already, or even if not more. And I want to thank you for that. But please, the best way I can monetize my page is on YouTube. And if my page is monetized, I'll have more resources to give you more lectures and educate you further. And my video quality will improve. There are some things I still need to buy to improve my delivery of content, my content creation. You can help me to achieve this. Thank you so much for your support. Bye bye.